Hi, this is County Judge Samaniego. The 2020 census count is incredibly important for El Paso. It helps our school, healthcare, food and housing programs get the money they need.
This is County Commissioner Vince Bettis for Precinct 3. With your participation, the programs that support affordable housing, public education, and affordable healthcare can receive the funding they deserve.
This is Commissioner Carl L. Robinson, Precinct 4. Without you, these programs could not be successful.
This is Commissioner David Stout. Participate online, by phone, or by mail. Everyone in El Paso County must be counted, even children and babies. Your responses are safe and required by law to be kept confidential.
Hi, this is Commissioner Carlos Leon from Precinct 1. Let's come together and fill out those 2020 census. Together and fearless, we count.
The County of El Paso Public Works Department is offering sandbags at no cost or requirements to the public. The sandbags are outside of the facilities and are available 24 hours a day. The location of the county facilities are the following: the Road and Bridge Fabens Warehouse, located at 1331 North Fabens Street in Fabens, Texas, 79838. The Road and Bridge Canutillo Warehouse, located at 191 Canutillo Avenue in Canutillo, Texas, 79835. And the Road and Bridge Montana Warehouse, located at 14698 Van Lane, El Paso, Texas, 79938. Don't wait in line, pay online. Visit the Financial Recovery Division website at http://www.epcounty.com/budget/financialrecovery.htm to make your payments online or find out more about our kiosk locations. We now accept payments on misdemeanor, felony, and justice of the peace cases.
You can now watch Commissioners Court meetings on YouTube. Go to youtube.com and search for El Paso County Commissioners or El Paso County, Texas. Subscribe to our channels to see our latest videos.
Did you know the County of El Paso's Purchasing Department is responsible for ensuring that all items and services needed by various county departments are purchased in the manner required by the state of Texas? Whether through formal sealed bids or smaller dollar quotations, the county purchasing team is dedicated to finding the best contracting return on your taxpayer dollars. Additionally, the Purchasing Department is responsible for the tracking of inventory within the county and properly disposing surplus through public auctions. For questions about how to become a vendor and compete for county contracts, or to learn more about public auctions, please contact us at telephone number 915-546-2048.
The 346 District Court Judge Angie Juarez Barril started the El Paso Veterans Treatment Court program in 2012 for veterans and active service members that have been arrested and charged with a felony or misdemeanor criminal offense. To be considered for this specialty court, the statutory criteria includes be a veteran or current member of the United States Armed Forces, including a member of the Reserves, National Guard, or State Guard, and suffer from a brain injury, mental illness, or mental disorder, including PTSD, or be a victim of military sexual trauma, all occurring or resulting from military service. Call Sylvia Serna, Veterans Program Director, at 915-546-2119, or email her at sserna@epcounty.com for any information.
Did you know that the County of El Paso's fixed asset control and inventory disposal is handled through the Purchasing Department? Throughout the course of each business year, the county holds live public auctions to dispose of aged equipment, vehicles, furniture, and other items that are no longer needed. To find out about upcoming auctions or to learn more about the county's inventory disposal process, contact the purchasing department at telephone number 915-546-2048.
Go ahead, Cesar.
Good afternoon. Today is Tuesday, August 4th, 2020. This is a special joint meeting of the Commissioners Court and the El Paso County Hospital District Board of Managers. Today we're joined by ASL interpreters Selena Salum and Dario Garcia. Jennifer?
Good afternoon and welcome everyone to our Special Board of Managers El Paso County Hospital District meeting and El Paso County Commissioners joint budget work session. Today is Tuesday, August the 4th, and the time is 1:14. Ms. Jennifer, do we have a quorum on our side?
Yes, Mr. Chair, we have a quorum. We have full board participation.
Wonderful, thank you.
Item number 2 is the Pledge of Allegiance. Would you please rise and join us for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item number 3 is public comment.
Okay, go ahead.
Oh, I'm sorry, Judge. Go ahead, sir.
No, you go ahead and read it, but I'd like to have a little introduction before we get started on the item, or after you read the item.
Actually, go ahead, sir. I can wait.
Okay. Well, I just want to thank you. I know it's difficult that we were trying to meet, but very thankful for the time. I want to just start off. Today's a very special day, and I'd like to wish Betsy Keller a happy birthday today. So I'd like to start off by.
Happy birthday, Betsy!
Woo!
Thank you all.
You know, Betsy.
Happy birthday.
Betsy has done an outstanding job, and especially coming out of August the 3rd. Just amazing support, just a lot of moving parts, a lot of passion and excitement, not only the last couple of days, but it's almost been a year since we started the idea of getting ready for our first anniversary and all the things that needed to take place, and hoping that we had a monument ready, but almost did, and a lot of infrastructure and a lot of work from Parks and Recreations and so many people that just pulled in. But one of the things I wanted to say is that you know, as Commissioners Court, myself, and the commissioners, I hope that we did justice to the Children's Hospital, to UMC, and El Paso Health in recognizing everything that you all did, and the board of directors and the support and everything that took place on August 3rd and the following weeks and months. Just the passion, the excitement of trying to help and trying to make it better for families, and everything that took place. And I'll never forget that first day of having doctors, having them to sort of chase them away because they wanted to stay there beyond their shifts, and everything that came together. And so Jacob, Cindy, and Frank, you have a wonderful team. And like I said, I tried my best at every venue and event to thank everything that you've done, and it continues. As you know, we still had some victims still struggling, going through surgery, being seen by doctors there at UMC. So just I hope that we did justice to everything that you did, and of course the board, the support that you've received. We're extremely proud of our relationship with the county and the hospital district, and I think today will be another opportunity to do that. The other one, obviously the medical examiners, sometimes we have a tendency to leave them out of the picture, but they too were just amazing, and still are to this day as we're going into the COVID, just as you are. UMC Children's Hospital and El Paso Health, this COVID crisis has been very difficult, but the partnership that we've had between the county and yourselves through these two very difficult situations have eased off some of the burden, and the community, I know, is very grateful and thankful. Jacob, special thanks to you in taking leadership, not only with UMC and the hospital district, but the leadership that you've taken across the board, your relationship with the private hospitals, the relationship and respect that they have for your leadership has really helped. Nothing worse right now than any fragmented relationships and when you're going public and private, it sometimes gets very difficult, but you've seen to be able to mitigate that and take us to a much better place. So once again, thank you to all the board members and for being here and all the teams and individuals that get us to this point. So thank you very much. Caesar?
Thank you, sir. Item number 3 is public comment. At this time, we have no public comment, but if we do receive some calls, Judge, we can let you know, we can revisit item number 3. Item number 4 from the regular agenda, receive a presentation on the El Paso County Hospital District fiscal year 2021 operating and capital budgets. Item number 5, discuss and take appropriate action on the El Paso County Hospital District's capital and operating budgets for fiscal year 2021 and proposed tax rate.
If I could say, Judge, I really appreciate your comments related to this hospital and, you know, what it went through during the August 3rd and its aftermath of the shooting, what it's going through with COVID-19. We're very blessed. We have a great group of commissioners and you, Judge, and my board. I will tell you, I remember that Saturday very well. You met me down here. I remember every one of you had come through at different stages and wanted to check on the staff and see how they were doing. I will tell you that very appreciative of El Paso Health and Frank Dominguez and his crew as they became the epicenter for law enforcement to conduct their investigation and interviews, children's and UMC in terms of providing care for the patients. And clearly, you know, Texas Tech and their contribution with their amazing medical team. You know, one of the things they always talk about was what is the impact of the staff. And so we know that for our medical staff and our hospital staff, our frontline heroes, we're always ever vigilant to make sure that they're getting the things they need. And I will tell you, I'm very fortunate that my board and my commissioners have always provided us the support we need to provide care for those in our community. So for that, I'm very thankful. Before we begin, just briefly, I mean, these have been unique months on the aftermath of August 3rd and getting our last patient, you know, stable enough to leave the hospital. We then faced the COVID-19 issue. Today, we're in better shape than we were when it first started. We have multiple ways of testing. If a person has COVID-19, we have ways of testing for antibodies. We certainly have much better supply in terms of personal protective equipment and such. And working with the state, the governor, for example, today also has assured that not only we, but even the school districts will have plenty of PPE from their storehouses. So, you know, while we are still out of the woods, our numbers are plateauing a bit, declining a little bit. From a capacity standpoint, we've had our challenges, but never have we had to turn away a patient. So we're real happy with that. And I give credit not only to my team, but Texas Tech as well as HCA and Tenet. Everybody has worked well together, sharing resources and support, putting our community first, and for that I'm very proud. You'll see with Michael's presentation, you know, some of the challenges we face with COVID-19. And I've got to credit my team that when this first occurred and before we received any CARES funding, we were very worried about the shutdown of elective cases and the impact on our ability to provide the financial support for the things we needed to do. And yet, with Michael, Newton, and Pini, and Leslie Flores, worked really well in terms of looking for ways to manage our expenses so that our care for our patients wouldn't be compromised, so that the support of our staff would not be compromised. We're real proud that we didn't have to do any furloughing. We were flexing, and even at that, we got to a point where we said, we'll flex, but no more than below a certain number of days. We just wanted to make sure that, you know, our staff would be at a position where they were still sustainable. And so very proud of our team, the things we did, and the CARES Act support only helped us, in terms of preparing for the following year to come. We don't know what's going to happen after this fiscal year going into October. We know there is no vaccine yet. We're hoping that the sooner there is one and the sooner it's distributed, depending on its effectiveness, we'll be able to address this pandemic better. Until then, there is no assurance that there'll be any more support financially from the federal government, though I know they're working on some plans. No assurance as to what that would be or if it would impact safety net hospitals. And I know that we're not sure what the numbers would do to us in terms of going into winter months if things get better or worse. So this coming year's proposed budget is very conservative. We're looking at really how do we preserve cash in the event that things don't happen. It would take 2-3 months of, for example, closed elective cases to put us in a real bind. So a lot of thought went into preparing this budget, and with that, I'll pass it on to Mike.
Okay, at this time, let me just read the 2 items into record. Item number 1, discuss and take appropriate action regarding the fiscal year 2021 El Paso County Hospital District operating and capital budget. Agenda item number 2, discuss and take appropriate action regarding the proposed 2020 tax rate for the El Paso County Hospital District.
Okay, good afternoon, everybody. Michael Nunez, Chief Financial Officer for the El Paso County Hospital District. On there was one additional slide that was included in this packet that you may have not received from yesterday, and it's just one additional slide regarding the timetables. After discussing the recent tax law changes with Omar's discussion with the county, we did want to throw out some scenarios, whether we have 1 joint work session, 2 joint work sessions, but then also 2, what, as a result of the new tax law changes, what's different than what it was last year. So for example, if you're looking at the Monday, August 24th on slide number 2, once we do have the actual public tax hearing, previously we could have about 14 days from the tax rate hearing to actually vote on the tax rate. Now it is 7 days. So when we do get to discussion at the end of today's meeting, we will talk about and work backwards in terms of when is the Commissioner's Court going to actually vote on the tax rate. It could be that we vote on the tax rate at one meeting and then vote on the budget on another meeting, but that's all contingent upon when we decide to have the tax rate hearing. So on slide 2, this is an example of what the timetable may be if we have 1 joint work session. On slide 3, this will be the budget timetable. Basically, everything moving back 1 week as a result of the 2nd joint work session, if that is needed to be had. I'm going to turn this over to Jacob right now to do a brief introduction in terms of our fiscal 2020 operations highlights.
So this fiscal year, we've been very proud of our service line expansion. Our neurosurgery, when I first started here, had 3 neurosurgeons, and we're now grown to 7. The largest group in the city, and it includes pediatric neurosurgeon that primarily services El Paso Children's, and it's become a strong team to be able to build a foundation on for our expansion in neuroscience. We have 3 neurointerventionalists, soon to have 4 through Texas Tech. And we have a strong neurology program under Dr. Cruz Flores that includes 24/7 neurology coverage. We've also begun, we opened a 501A organization that allows us to employ physicians as we begin to look at different venues to expand our physician base to support our community and the volumes we have. And we're in the process of upgrading and replacing our last path lab of the 4 that we have, should be done sometime in October. These are services that provide better technology, and it improves the ability of our organization to provide state-of-the-art care. We did receive about $600,000 from the Texas Health and Human Services Commission, thanks to Representative Art Fierro, for the implementation and operation of a mobile stroke unit that we hope will be on site sometime in January. This will allow us to actually do a head CT on scene so that we can begin treatment on scene as opposed to waiting till they get to a hospital. We opened 2 satellite emergency departments, and this fiscal year 21 will be the first year that they'll have a full 12 months of operation. And with that, it included 2 CT scanners, one for the east and one for the northeast to provide additional care. And we were recently notified that we once again were certified as a certified stroke center by Joint Commission, the only one in El Paso that is certified by Joint Commission, so we're very proud of that. In terms of market share data, just briefly, we continue to show growth in the neurology, general medicine, general surgery, and orthopedic service lines. We are working on being able to expand our cardiology service line as well, and are in works with them in terms of acquisition of additional faculty, along with growing our trauma program. We're working on some things that we're not quite ready to announce yet that'll help enhance our trauma program. And under Dr. Alan Tyrock's leadership, I know we'll be in good hands. Oops. So with El Paso Health, one of the things that we're very proud of is that they continue to show great support to the community. Frank Dominguez and his team are constantly working on improving care in the much needed areas out in the rural community. Part of that plan was to expand not only from a Medicaid service platform, but to also grow into a Medicare service platform. And he did that with an expansion plan that included dual eligible special needs program. El Paso Health continues to be the market share leader. They maintain a 58% market share for Star and CHIP. And it's not just growth, but when you look at their quality rankings, they're still first in Texas for following the Star and CHIP 2018 Quality of Care Rankings, which is the most current we have. That includes adolescent well care visits, weight assessment and counseling for nutrition, and physical activity for children and adolescents, well child visits in the first 15 months of life, and immunizations for adolescents. They're also the excellent 2019 provider satisfaction based on survey results that showed a 92.8% satisfaction rating. When we had the Star Plus program that was subsequently put out back to the original platform due to some issues that the state had with a couple of the implementation of the program in Houston and San Antonio. Prior to that, we were the only community health plan that had been approved for Star Plus. It was our first time applying, and Frank and his team scored the highest in terms of the evaluation scores of any health plan in the state of Texas. So we're really proud of that and look forward to being able to get back on that list when the bidding opens up again. In terms of El Paso Children's and their higher levels of service, they got redesignated for NICU level 4. They have an American Cleft Palate Association approved craniofacial team made up of Dr. Burke and his team's support. The level of surgery and what they have done have taken us to a whole new level. We're really proud of their work and contribution to our community. The Oral and Maxillofacial Surgery Craniofacial Fellowship is one of 8 fellowships internationally, and they continue to be certified in as a children's oncology group with national protocols, and they've expanded their pediatric neurosurgery and craniofacial programs. In terms of market share, Children's has a right to really be very proud. Some of the things that we've seen, some strong growth. If you look at any of those items in that slide that are blue, that shows growth. Some of the strongest growth was gastroenterology, where they have a 32% market share, neurology at 39%, neurosurgery, 48.6% market share, and then orthopedics at 46.4%. And their plan to grow continues as they look at acquiring additional service line growth areas in areas such as cardiology. In terms of the UMC and EPCH Foundation, as you know, we acquired our new executive director, Estela Casas. It says re-energized board with John Johnquist at the helm. John Johnquist has been a part of the foundation board for many, many years, and he does bring energy and accountability to the board that we're very proud of. But I'd be remiss in saying that Estela has really not only energized, but bullied, coerced, intimidated us to really meet her level of expectations. We're really proud of that because despite the global COVID-19 pandemic, they were able to raise $1 million from January through June of 2020. Now I'll pass it on to Michael.
Okay, before we talk about the 2021 budget, I do want to give an update on where we are right now through 2020. Our rating agency scores, this is very similar to what you see in the Finance Committee books. Fitch, we were A minus, S&P, BBB plus, and Moody's Baa2. We do have an annual surveillance call update with Standard & Poor's scheduled for next Thursday. We have not heard anything from Moody's and Fitch. We did hear this through a webinar conference that because of the pandemic and so much uncertainty, that they have no planned annual surveillance calls, at least in the near future. In terms of the hospital district's performance, I want to take you through 2 points in time, February of 2020 and also June of 2020. The top illustrates where we were compared to budget through February of 2020. You'll see to the far right corner of the top slide, we had a positive net increase in net assets of about $5 million. That's about to prior years. I'm sorry, here's to budget. We had an actual of $5 million, a budgeted net decrease of $490,000. So there was an overall a favorable variance of about $5.5 million. The bottom slide compares us now where we were as of June of 2020. You'll see the actual, because of the CARES Act funding that I'll be talking about here in just a few minutes, we do have a net increase in net assets of about $36.5 million compared to a budgeted net decrease of $647,000 for a positive variance of $37 million. If you normalize it without the CARES Act revenue, the net increase would be about $5.6 million. We would still have a positive variance to budget of about $6.3 million. Okay. Anthony. Can you help me? Yeah, it makes sense. There you go. Okay. On slide 15, this is our 2020 performance to prior year, and it shows here that as of through the top part is through February, we were $7.4 million improvement over the same time period in 2019. The bottom part is taking it through the 9 months through June of 2020 compared to June of 2019, and you'll see down at the bottom right corner, the district as a whole is about $12.2 million better than we were in 2019. The next slide, on slide 16. Now this is looking at the district's overall current ratio for the past 18 months or so. You'll see now as of June 2020, our current ratio is now 1.28. The same period that we were last year was about 1.04. So you'll see that we have improved our balance sheet and the financial position. A large portion of that started to come starting in April when the district started to receive some of the CARES Act funding, and then the larger portions came in during the month of May and also June. The district's days unrestricted cash on hand, you'll see through June of 2020 in the red line, we're now at 79 days compared to the previous same period 12 months ago at 29 days, so an overall improvement of 50 days cash on hand. You'll see overall in terms of starting in April and May, the days cash on hand started to hit the mid-50s, up to 79. And what I do have illustrated in the dash is that in July, we're projecting this to be about 89 days. The main reason for that is that we did receive some district funding during the month of July. you'll see will decrease to about 70 days in August, and the main reason for that is we have our semi-annual debt and interest payments on our existing bond issues. So at the end of September of this year, we do project that will be approximately 60 days. The next couple of slides are going to illustrate both on UMC and El Paso Children's the effect of the pandemic that we have experienced since, particularly our height of our volumes were back in January, and then, where we bottomed out during April. On the left-hand side, admissions UMC, you'll see we were at 1,461 in January. We bottomed out at 999 in April, and we've had some recovery where we're up to 1,233 as of June. You'll see the same thing for El Paso Children's, but one thing to note is the pediatric recovery has been slower than on the adult side, but also when you look at the months now, May, June, and July, this is typically the slower season, or from a volume perspective for El Paso Children's. You'll see that they bottomed out at about 211, and they have recovered slightly to about 270. Our average daily census, again, you'll see this, this V shape where on the UMC, we were as high as 242, and we were at 167. In June, we're at 219. El Paso Children's, we're at 71. We went down to 41, and they recovered slightly to about 51 average daily census during the month of June. The average case mix index, you look at for both hospitals. Now, one interesting thing to note here is that during the months of April, May, and June, which was right after the pandemic started in March, you'll see that on both sides that they have started to increase. UMC, we're now up to 1.57, and on El Paso Children's, we're up to 1.86. Our outpatient visits, similar story, where the volumes bottomed out during the month of April, and similar to the admission side, you'll see that the UMC recovery has been stronger. As you'll see now, we're back up to 75,000 visits during the month of June. Children's has also started to recover, but their recovery has been slower. But you'll see they were at 1,420 during April, and now they're at 2,669. One last slide, emergency room visits. You'll see the same thing here in terms of, now on the UMC side, our peak was actually during the month just right before COVID-19 hit, and we were down to 3,800 in April. We have started to recover, but we're only at 5,000 during the month of June, so we're still about almost 750 or 1,000 ER visits behind where we have been. Again, on the El Paso Children's side, on the right, you'll see in terms of their numbers, and you'll see that the recovery has been slower as well. The UMC bursts, you'll see that oddly enough, during the month of May and June, we're down at 142, compared to previous years, and this, as illustrated on the next slide here, on slide 24, you'll see that the declining bursts across the U.S. and the El Paso County, going back over to 2019. You'll see on the right there that we've had a 21.3% decline in bursts over the last 5 years. I'm going to move on. Let me move on to our paid FTEs. Earlier, Jacob was talking about our cost control in terms of when the volume started to decrease, mainly because of one, elective surgeries were canceled right when the pandemic started. You see UMC, we're at about 2,800 paid FTEs. We dropped down to about 2,560, and because of the volume increase, we're starting to slowly grow that back. And you'll see El Paso Children's as well. They were at 641 paid FTEs, dropped down to 519, and then now they're up to about 571 as of the month of June. In terms of efficiency, when we look at our paid full-time equivalents per adjusted occupied bed, this will be the inverse of where you saw our volumes, where you saw during the month of April where the volumes dropped. You'll see that our paid FTEs per AOB actually went up, but now that the volumes have started to recover, you see improvements in both UMC and El Paso Children's in terms of the overall paid FTEs per AOB. Now what I'm going to do is I move on now to the 2021 operating budget. In terms of now on slide 30, in terms of overall, how the COVID-19 pandemic has impacted the budget preparation. In terms of how we presented this budget or how we prepared this budget was we used the 12-month activity for March 1 of 2019 through February 29 of 2020 as our base. Then from there, we went ahead and increased or decreased that based upon known factors, whether there was going to be additional volumes for UMC, such as the ambulatory surgery center, et cetera. Now, the uncertainty remains as to how long the pandemic is going to last, and then also the federal emergency relief in terms of how that is going to last. So that is the biggest uncertainty with this 2021 budget. We talked about the elective surgeries, what happened when those were canceled. And then in late May, the governor authorized elective surgeries to re-begin. And then early July, although elective surgeries have been canceled in major Texas cities, with the exception of El Paso, that has been it's still a big benefit to the El Paso area, as we still have the ability to perform elective surgeries. When we talk about the CARES Act, there's a CARES 3.0, and this is really specifically more to hospitals, although the entire package was for citizens, et cetera. But as it pertains to a hospital, there was $100 billion to reimburse hospital for COVID-19 lost revenues and related expenses. Also, the thing called the Accelerated and Advanced Payment Program, that I'll talk to you here in the next slide or two. The scheduled Medicaid dish cuts that were supposed to happen this year in 2020. Those have been delayed to November of 2020, and then the expanded use of telemedicine. There was another relief program called the Paycheck Protection Program. Some people dub this as CARES 3.5. There was an additional $75 billion to the Provider Relief Fund, so to hospitals with the CARES 3.0 and the Paycheck Protection Program was a total of $175 billion. Now, through June 30th, UMC has received $29 million in CARES funding. We've recognized $24 million of that in our financial statements, and $5 million of that is deferred. Now, how we recognize this as revenue is going to be the sum of two factors. One is the lost revenues that we have experienced because of COVID. And the accounting literature says that we can compare that one either to budget or to how we were trending. And then the second sum is going to be the COVID expenditures that we have incurred, such as for our personal protective equipment, such as the masks, the gowns, the face shields, the tents that we put outside the emergency room. All these are COVID-related expenditures. So that's how the accounting guidelines have come down and told us as to how we can recognize this as revenue. El Paso Children's, they have received $16 million in funding. They've recognized $6 million to date through June 30th and have deferred revenue of about $10 million. Now, subsequent to June 30th, which happened probably about 2 weeks ago, UMC did receive an additional $13.1 million in CARES funding for what Health and Human Services defined as hotspot distributions. So there's probably been about 6 or 7 distributions from the CARES funding, all with a different calculation. This latest one, Health and Human Services asked hospitals to submit the number of COVID-19 positive hospital admissions from January 1 through June 10th. And so that was the information we submitted. So we were able to, UMC was able to receive $13.1 million in CARES funding. As we talk about what's called the Advanced Payment Program, back in April, Health and CMS, the Centers for Medicare and Medicaid Services, designated this program as this is a loan to help hospitals to manage cash flow during this pandemic. Now, this loan must be paid back. It was based upon 6 months of Medicare payments from the most recent file cost report, and hospitals have from up to 1 year from the disbursement to the hospitals to repay the loan. In UMC's case, UMC received $30 million in April of 2020. The claims recoupment on this is going to begin in August, and it's probably going to start around the third week in August, pending if there's any new updates coming in from Washington between the Senate Republican package and the House of Representatives. So that would, I'm estimating that would be about $5 million per month. I am forecasting that the advance will be repaid in full by February of 2021, and then the advance must be repaid by April of 2021. If not, interest would start to be accruing at about 10%. Another item under the CARES package is what's called a Federal Medicaid Assistance Percentage, otherwise known as FMAP. What this in essence did, this increased the federal share of the IGTs that we do get to get the federal match by 6.2 percentage points. So what this meant is all the IGTs that we normally send to Austin for all our Medicaid supplemental programs, it would cost us about 38 cents. Now, since the federal emergency period started, it costs us about 32 cents, for each of the Medicaid supplemental dollars that we get. This is in effect right now from January 1, 2020 through September of 2020, although there was an update probably just about a week ago with the extension of the federal emergency period, that this FMAP, the enhanced FMAP, will now run through December 31st of 2020. The 2021 budget, as we had built it, had no benefit from this extended enhanced FMAP, and the 2020 benefit was approximately $6 million to the district, both also to UMC and also to El Paso Children's. The Medicaid Disproportionate Share Program, the scheduled dish cuts were scheduled to take into effect this year, but because of CARES 3.0, those were extended through November of 2020. Now, Congress will have to revisit if the scheduled dish cuts will be extended beyond November of 2020, and the 2021 budget assumed that the dish cuts will not be extended. Thus, there's about a $3 million revenue reduction from 2020. One of the last Medicaid supplemental programs, the Uniform Hospital Rate Increase Program, otherwise known as Europe, which does apply to the STAR and STAR Plus programs. In essence, what this does is through intergovernmental transfers that hospitals provide, the corresponding federal match goes to the managed care organizations. The managed care organizations will then increase the payments to hospitals by a percentage above their respective base contract that they have with the managed care organizations. For fiscal year 2021, the statewide pool is being increased from $1.6 billion to $2.6 billion. And then also in terms of the percentage increases by hospital class, you'll see the difference between 2020 and 2021. The urban public, such as UMC, we will remain at 52%. Children's hospitals, they will get a bump from 2% in 2020 to 57% in 2021. As a result, El Paso Children's net revenue incremental benefit is about $9 million. But however, because of the enhanced Medicaid rates that they're going to get paid next year, we do forecast that they will no longer qualify for dish funds. So overall, there's about still a net $4 million increase to El Paso Children's. UMC's net revenue benefit remains at about $3 million annually, but since the percentage stayed the same, there's no incremental benefit from 2020 to 2021. Some of the current legislative topics that we are following right now, back a couple months ago, the House of Representatives did pass their $3 trillion Health and Economic Recovery Emergency Solutions Act, known as HEROES. Right now, Senate Republicans introduced, I think about a week ago, a smaller $1 trillion package. Some of the items included in this relief package include additional $25 billion allocation to the Provider Relief Fund. The takeaway from this comment here is that this is a lot smaller amount than the $175 billion that was in the CARES Act. So with lesser amounts being allocated to the Provider Relief Fund, the monies that we have received currently, we're going to need to make this last as long as we can, unless there are additional relief programs coming down the road. As it pertains to the advanced payment program from CMS, there is discussion now that the recoupment period, the start date from August 20 could be pushed back to January of 2021. So those are some of the things that we are looking for. Then also some of the other things that are currently not in the Senate Republican package, down at the bottom, is the Medicaid disproportionate cuts. Now those are still expected to occur in November. So we're closely watching to see as to what may happen in Washington. One of the key budget variables for UMC and El Paso Health, as those associates participate in the GCDRS program, is GASB 68, the accounting for the and financial reporting for pensions. Keeping in mind that the measurement date is December 31st and our financial date is 9 months later, September 30th, there's a 9-month lag between these two dates. So right now, the pension plan's funded ratio as of December 31st, 2019 is about 92%, but that was coupled with about a 17% investment return in calendar year 19. 12 months earlier, the funded ratio as of December 31st, 2018 was 85%, but that year's investment return, calendar year's investment return was a negative 2% investment return. So the last bullet, you'll see the investment return is a vital component of how the plan's retirement expense is going to be actuarially determined. We have received preliminary estimates from GCDRS actuaries regarding what the plan expense would be, assuming these rates of return. A 4% return would generate a pension expense of $12.1 million. A negative 4% return could indicate a plan expense of $19 million, so about a $7 million range. So the challenge here is we will not know what the calendar year 2020 return is going to be till 5 months from now, but our budget's going to start here in about here in about 60 days. So what we have done, we have budgeted for a 0% return for a plan expense of about $15 million. But we won't know the true impact of this until probably January of 2021. A couple of items for El Paso Health. One of the big things that we talked about last year, which was going to be a major initiative for El Paso Health, was the Star Plus program. Now, El Paso Health was awarded the contract in December of 2019. However, HHSC canceled the statewide contract in March of 2020, and now we are looking for a possible reprocurement of the Star Plus program, not until the third or fourth quarter of 2021. What this does, as El Paso Health is entering the Medicare Advantage market, it does put it currently at a market disadvantage with their Medicare dual eligible special needs program because of the Star Plus cancellation. And then for next year on Star and SHIP programs, we do just want to mention there potentially could be a mid-year capitation rate adjustment at HHSC's discretion, so we do not know as to whether that would be upward or whether that could be a downward effect on their capitation rates. On El Paso Children's, we talked about the volumes uncertainty regarding COVID-19 in the pediatric arena, and then also capacity challenges as we look pertaining to the pediatrics and the specialty clinics. Jacob did go over a couple of these things, the mobile stroke unit, the surgery west, etc. Let me go on now to talk more about the financial numbers as we're looking to the 2021 budget. On slide 42, I've gone back and have shown what is the district's net position change since 2017. In 2017, there was a $41 million net decrease in net assets. In 2018 was $31 million. In 2019, $11 million decrease. And this year's budget, we had budgeted slightly less than $1 million net decrease for the hospital, for the district as a whole. For 2020, you'll see the forecasted with the CARES Act revenue. We do forecast that this year's net earnings will be a positive $44 million. On a normalized basis, without the CARES Act revenue, we forecast that to be about 10. And then for next year's 2021 budget, we are proposing a budget overall with an $8 million increase in net assets for the hospital district. The next slide is the same information as the slide before, but it just breaks this out by each of the individual component units. Emphasizing on the far right column for 2021, you'll see UMC would be about $3 million negative. El Paso Health, positive $2 million. El Paso Children's, about $7 million positive. A large portion of that coming because of that year-up rate increase that we talked about earlier. The foundation, about $1.4 million. And then the new component unit, El Paso Healthcare Inc., an initial budget for them to start about $563,000 negative. So that's an analysis of the change in net position by component unit for next year. And looking now, how does this budget reconcile to cash in terms of from accrual basis on the income statement to actual cash? At the top of this slide, you'll see our beginning balance where we were September 30th, 2019. The district as a whole, we were about $45 million in cash. Now down to the bottom, you'll see that we do project that by September 30th, 2021, we do project that the district will be about $130 million in cash, which will represent about 52 days cash on hand for the district. On the next slide, on slide 45, I do want to go back and take a snapshot in terms of the district's overall cash position going back to 2011. You'll see in 2011, the hospital district had about $125 million in cash, which represented about 117 days cash on hand back then, but the cash expense was about $1.1 million back then. In 2021, although we will have slightly more cash, projected about $131 million, because the cash expense per day is now about $2.4 million, that represents about 53 days cash on hand. So that's looking at the last 10 years in terms of the overall district's cash position. On slide 47, overall looking at the district revenue budget, we are proposing a $941 million revenue budget. You'll see the largest components, net patient service revenue, about 47%. Premium revenue from El Paso Health capitation rates they receive, about 23%. Our Medicaid supplemental, about 11%. Property taxes, 13%. And then other, about 6%. And looking at the proposed 2021 expense budget of $933 million, the four largest categories you'll see will be salaries and wages, about 33%, medical claims about 19%, and those are from El Paso Health. Supplies and pharmaceuticals for UMC and El Paso Children's, about 16%, and our physician fees about 12%. The next couple of slides, I will just quickly go through these, but this is more informational only. This will show you what the annual volumes are, like for admissions, our average daily census, outpatient visits, et cetera, both for UMC and also El Paso Children's. Let me talk a couple things on some of the significant expense assumptions, and I'm now on slide 56. For salaries and wages, overall, we are projecting about a $15 million increase in salaries and wages. We do plan a 1% merit, which approximates about $1.8 million, which will begin December of 2020, following just right after our annual evaluation period that usually is during October and November. We do have the full year of the $11 minimum wage implementation that we just started the last month in July of 2020. Its full 12 months cost is about $3.7 million. We also have now the full year of the 2020 market adjustments also implemented in July that would cost about $2.6 million. And then we do have a FTE plan increase coming in from the ambulatory surgery center, now having a full year of the 2 new satellite ERs, as it would only been in operations about 8 or 9 months in 2021. And then the primary and specialty care growth at the neighborhood health clinics and the mobile stroke unit. And looking at a couple of major expense assumptions for El Paso Health, you'll see the STAR program, the membership increase of 7.5%. A large portion of this is having to do with HHSC's decision for a no disenrollment during this pandemic period. We also did see 11% capitation rate increase for STAR, and we saw a 7% capitation rate increase for CHIP. Overall, there's a budget of about 86% for their overall medical loss ratio. El Paso Children's, as we look at some of their significant expense assumptions, they do plan a 2% merit increase starting in the second quarter of fiscal 21 that approximates about $480,000, and then also market salary adjustments of $350,000, and then they do have budgeted for a paid FTE increase of approximately 33. Let me look now on as to how we're looking at our for fiscal 21, the 2020 tax rate scenarios. From left to right, I start off with, in fiscal year 2020, what's our current tax rate? Now, the total taxable value right now is about $44.7 billion. The total tax rate is about 26.7 cents. So that is estimated to bring in approximately $120 million in property tax revenue. The average home value last year was $133,590. So the property taxes due on an average home value would be $357.68. As we move forward now to 2021, because of the increase in the taxable value that is now $46.7 billion, or about a 4.44% taxable value increase, what was previously known as the effective rate and now being called the no new revenue rate, that actually decreased to 26.5 cents from the current 26.7 cents. Based upon the taxable value of the $46.7 billion, this is estimated to bring in approximately $124 million in property tax revenue, or about a $4 million increase from the current year 2020. The budget that we have prepared and have proposed is currently to stay at the current rate of 26.7 cents. I'm now referring to the middle column of the fiscal year 2021 section. So based on 26.7 cents, the property tax revenue would be about $125 million, slightly about a $1.1 million increase in overall property tax revenue between the current rate versus the no new revenue rate. The home value increased this year now to $135,290. So the overall, the annual property taxes due on an average home would be about $362. Overall increase about $4.55 from this year, with $3.30 being the difference between the effective, or what's known as now the no new revenue rate. On the next slide is looking at the taxing entities, what our current tax rates are. You'll see left to right, UMC as about 8.6% of the county taxing entities when being compared to the community college, El Paso County, the city, and also the schools. This slide is here to illustrate on UMC El Paso because of the estimated uncompensated care cost. And looking at the last two years, 2020 and 21, this year we do forecast the estimated uncompensated care cost to be about $185 million. Our maintenance and operations property tax revenue is about $99 million, so we have a variance of about $86 million. For next year, this budget has estimated uncompensated care cost to increase to $210 million. The maintenance and operations property tax revenue will increase by $3 million to $102. So the variance will now be about $109 million between what we get for maintenance and operations property tax revenue versus the estimated uncompensated care cost that UMC provides. On this slide, on slide 64, this is just a quick comparison between the 2020 forecast for UMC El Paso versus the 2021 budget. And the major line items, you'll see that in 2020, patient service revenue comprised 46%. In 2021, that's going up to 52%. Our Medicaid supplemental revenue is currently 20%. We see that decreasing to 17%. And then the property tax revenue, last year's 22% for UMC, and next year will be about 20%. One of the things that we also like to illustrate is how is UMC El Paso compared to some of the other large public Texas hospitals that we have. Now, this is based upon their most recent audited financial statements. Two others, JPS and Parkland, have the same fiscal year end as UMC El Paso does. University is 3 months later at December, and then Harris Health System 5 months later in February. But looking at here, and the main illustration is here when you look at the gray bar, UMC El Paso for 2019, the property tax revenue represented 21% of UMC El Paso's revenue budget. Harris Health was at 45%. JPS in Austin, Fort Worth was at 39%. University Health System in San Antonio, 30%. And then Parkland Health in Dallas, right around 29%. There's some other comparisons for 2018 and 2017. And one of the last items I wanted to talk about is the district's proposed routine capital budget. For UMC, about $15 million. El Paso Health, 1.6. El Paso Children's, 2.7, for overall $19.3 million. One item to note here is over the last decade, UMC's routine capital budget has been somewhere more like $8 million, $10 million, $12 million. But we've known with our annual depreciation expense on just routine capital and not including bricks and mortar was closer to 15. So we do know that we need to do some reinvestment in our routine capital, and we need we do need to catch up. One of the rating agencies did note that last year that that they saw that being as a potential drain on UMC's cash simply because of the reinvestment we need to do with our routine capital. And then last, on our 2017 bond funds, we currently have about $15 million left from that bond issue. We do forecast that to be entirely spent by September 30 of 2020. So with that, let me pause there. This completes the presentation of the 2021 El Paso County Hospital District, and I will now open it up to the audience for any questions.
Commenting on one of the things that we've talked about is the advance payments and the strategy to make sure that the alignment is proper. It's hard to predict what you've got in advance versus what's going to be coming in, and so I don't know if you want to address that. That strategy to make sure there isn't. I know the discipline. I've talked to both of you and about the discipline. That there's not a problem with making sure that it happens, or that we take, that we're not or taking the advance lightly and then not being able to accomplish that in the future. That's not ever the issue, but the strategy to make sure that there is an alignment with what you received in advance, and then the prediction of what's coming at you. So I don't know if you've addressed it with me in our meeting, but I'd like for either Jacob or you to address how do you make sure that there is that proper alignment, that there isn't a misalignment from those advanced funds.
Okay, and with that, yes, that is a very good question, and yes, that does require discipline. In our monthly cash flow forecast that we have from now until next September, yes, based upon historical Medicare volumes, that's been about $5 million per month. So based upon that run rate, we do have it built into our monthly cash flows through next year that would be paid out by February. Now, if in the event, let's say that the Medicare volume, because say we're only at 80% of where we were last year and it's only $4 million, we will ensure that I will be adjusting each month whatever amount has been deducted. If it's $4 million, then I'll just add it on to the next month. But all rest be assured that that this amount we will set aside so that it is paid off by no later than April of 2020, which is a required 12-month payment.
Thank you. The other one is that on the wages, I don't know if you'll be commenting later. We know that we talk a lot about the beds and availability, but staffing is really the biggest challenge as to whether or not we're able to staff. And of course, we have to look at the incidences of getting some of our healthcare workers getting ill, and also the competitiveness of the market. Could you address what you're doing for the employees and their benefits that sort of gives us a sense that we won't have either turnover or inability to staff properly due to not receiving the adequate pay or being able to feel comfortable within the market, that you are being competitive? So I don't know if you're going to address that now, or you could do it in one of the presentations, but There's a lot of concerns through all the hospitals about healthcare workers sort of not being in a very vulnerable situation and therefore maybe seeking other types of employment. And so I know the benefit structure is going to be extremely important to address some of these issues.
Well, Judge, if you recall, we started a few years ago looking at market adjustments to make sure that we remain competitive, and we're looking at about 25% of the workforce per year. And so we continue to do that. Now, fiscal year 21, we'll be doing some market adjustments, but not to the same aggressive level as we've done in the prior years, hoping that if after we're through with fiscal year 21 and hopefully that there's an effective vaccine related to COVID-19, that in fiscal year 22 we can do more in terms of our staff. But we've increased our minimum wage to $11. We've continued with market adjustments. We plan in this fiscal year to do a 1% merit in the upcoming fiscal year. And we continue to make sure, when you look at all those articles and the stories with the other facilities, a lot has to do with more availability of PPE and other safety equipment to protect their health, as well as their loved ones at home. We have really been very aggressive in terms of making sure that if you're, to protect you while you're at on campus, every patient is masked, every employee is masked. We provide them for you. We've also provided washable masks at no additional cost. We've gone through great effort to acquire personal protective equipment, including the masks. We continually, look at our inventory. Today it might be N95 masks. Tomorrow might be gowns or surgical booties or whatever. But we look at trying to make sure we have a steady stockpile for our staff so that we never have to ask them to scrimp. And so far we've been very fortunate in that. We've even provided PPE for one of the other hospital systems when they were short of their PPE. We work closely with Wanda Helgerson at Border Rack and with Chief Rodriguez at Office of Emergency Management, as well. They work closely with the statewide rack that also has a huge inventory of PPE available to the various areas should they need them. We also make sure that we provide them the ability that if they, for some reason, through community spread or whatever, become COVID positive, that if they're unable to self-isolate at home, we can provide them space at hotel rooms that we've reserved for their benefit so that they can self-isolate. Prior to this COVID starting, there was no way for us at UMC to test for COVID-19. And if there was, it would take as much as 5 to 8 days to get results. Today, we have the BioFire, Panther, as well as the Abbott rapid test with the help of the Public Health Department to be able to quickly, within 24 hours, know if a person is COVID positive or not. We've begun to do antibody testing for those employees that may want to know if they might have caught the COVID-19 virus and not realize they had it because they might have been asymptomatic. And so we've done a lot. Matter of fact, our turnover rate is one of the lowest in the city in terms of, fiscal year 20, all UMC turnover is at 10.45%. And when we compared the prior year to the national and state standards, we're below that. As it relates to nursing, our turnover is 13.45%. And again, we don't have the current national rate for fiscal year 20, but for fiscal year 19, that was at 15.9%. So we're very proud of the fact that we had a low turnover rate. We don't have a lot of money, but Lorena Navedo and her team really work hard at providing ways to address our employee needs, such as the food pantry, other events that occur in recognition of our staff. And quite frankly, without our frontline staff, we're nothing. So they are our number one priority.
Thank you, Jacob. And thank you for that safe environment. It's extremely important that the hospitals and healthcare workers are the role models for the rest of the community that are struggling with some of the information or how to go forward. And I thank you for that. And also for, as much compensating for, you know, the pay of trying to do the best you can, creating a wholesome environment. That's always extremely valuable that we do that. So I thank you, and it just reassures me that not having staffing is going to be very, very critical, not only now, but if we have a second wave and we don't have the appropriate personnel to match the challenges. And finally, another question, and you might answer it later, but Michael, you mentioned several dimensions where the Children's Hospital recovered a little slower, and you did make some of the reasons behind that, but maybe perhaps more comments as to why there's a little bit of a gap between the recovery from UMC on some of the financial dimensions and Children's Hospital, and then, you know, what are your expectations of sort of getting them back a little closer to the trajectory that UMC and Paso Health has. So I don't know who would like to address that.
Okay. I can address initially, but then Cindy, if you can follow right behind me.
Sure.
On some of these slides,
Quick, thank you.
you'll see that the children's recovery, and let me get to one of them, if the slide can be brought back up. But right now, you'll see that the children's recovery from April has been at a slower pace than the adult hospital, and the main reason for that is one, in terms of people coming into the ERs. On the pediatric side, that's been a lot slower than it has on the UMC side. So let me get to just one item, like one slide here, looking at admissions. You see here on the left-hand slide, on slide 18, UMC's recovery. You see more of that V, that V rebound, and on the children's side, it's slightly less. So Cindy, do you want to add to that?
Sure. Can you hear me all right?
Yes.
Okay. So is specifically related to how COVID is really affecting our pediatric population versus the adult population. First of all, we know that it's a very low rate in terms of occurrences for children. However, we also recognize that children can be carriers. With that being said, there still is some form of hesitation in seeking care. As we talk with pediatricians in the community, as well as with our Texas Tech partners, we noticed that the offices still continue to be slow. I think it's probably twofold. Part of it is that we're not really seeing children as much as adults coming out into the community, because basically the adults make that decision for them. You know, one of the things that we're monitoring very carefully is that what's it going to look like going into the fall season? How is that going to be looking for us in terms as the schools either consider still staying as a hybrid or staying online or moving to an in-person type setting. So there's a lot that we're just not sure about at this point, but I will tell you all of the pediatricians' offices in this whole area, as well as speaking with our colleagues across the Children's Hospital Association of Texas, are saying the same thing. It is really just slow in terms of pediatric care at this point. So our message is to encourage individuals, don't delay in seeking care, because we have seen instances where patients come in a little bit more critical than really what they need to be.
One thing, if I could add too, is that to Cindy's point, and we've seen it at every hospital in El Paso, is that people, because they're sheltering in place or they're afraid to go to a hospital, will delay care that's needed so that when they show up, they're actually in worse shape. And so there's been a communication signed by all the CEOs here in El Paso, encouraging people that if their health is at risk, to not hesitate to go to a hospital. As it is now, we know that we provide care not only for COVID patients, but for non-COVID patients. Matter of fact, the majority of our patients we're caring for at our hospitals are in fact non-COVID. And so, Michael, if you could go to the slide on the case mix index, you'll see that even though the visits are down, the case mix index is high. Case mix measures how serious the patient is when they get to the hospital. And so for children, UMC, and the other hospitals in the region and throughout the country, we've seen that volumes have dropped, but that the patients showing up are worse in terms of their health. So what we're advocating is we're still here open for business. If you feel that you have a health issue, don't put it off. COVID does not cure heart issues. It does not cure neurological issues. It does not cure cancer issues. So when those numbers drop, we know that it's indicative of people just simply delaying care. Additionally, because summers are tending to be slow months for children's hospitals in general because kids are out of school, and when you consider that there's that self-isolation and trying to limit the number of people that can meet and keeping a safe distance, there's also fewer of the typical things you see in the summer of, broken bones and falls and such, and may carry on even into the coming fiscal year with relations to flu. Some worry that flu mimics what COVID-19 has in terms of symptoms and is going to require more testing. On the other hand, some are saying if we're masking, self-distancing, washing our hands, the flu season may actually be a lighter one for us because of those precautions we're taking.
If I may add, this is Michael.
Jacob,
I'm going to go
sure, go ahead.
to the emergency. I'm sorry?
Go ahead.
To the emergency room visit slide, you'll see here, and this is not only happening here in El Paso, but it's also happening nationwide, that the acuity level of the emergency room visit since the COVID pandemic started is that we're seeing the more sicker patients in our ER visits, what we call the level 4, level 5 in our ER. So those are still coming to the emergency rooms. What has dropped off significantly since the pandemic started is the lower level, what we call the level 1 and level 2s. Those numbers have dropped significantly pre-COVID versus what we are right now. So the sicker patients are still coming to the ER. It's the ones that have the lower acuity that have stayed away.
Thank you. And that's great insight because from a community level, we had really talked about the delay in treatment for adults. And so this clarification of the impact that it's similar, right? That the adult is not taking the child as well and staying away from the hospital. So we've encouraged every opportunity we've had to encourage everyone. We've uncovered that that we need to focus now on health because of COVID. We realize we're in a very vulnerable community that has higher indices of diabetes, of heart issues, and so hoping maybe later on we talk a little bit about what does UMC look at as far as once we've unveiled this vulnerability. I think we knew it to some extent, but as you see the deaths at the mostly that high percentage in the 90s of underlying conditions. So the way to address, other than the vaccine, is also to make sure that we have a healthy population, especially from 60 and above, that do understand their vulnerability and do understand that if they do have diabetes or any of the other illnesses that Dr. Carranza has showed, that you're not more vulnerable. So I know that as you've always done, that you take a lead also as a hospital into addressing the healthcare issues of our community so that we won't be as vulnerable as we have, especially compared to other communities. We do have a much more vulnerable population. So anyway, just want to make sure that, that we understand that. But thank you for the children's, that collateral impact of delaying service, and then what does it mean in the future for UMC?
Thank you.
Judge, I don't know.
Commissioner
Stout? Commissioner Leon using his hand though first. If you want to talk to him first.
No, it's okay, Commissioner Stout. Go ahead.
I was just I wanted to kind of understand. So when you all were talking about, first of all, thank you for the presentation and the work that you're doing on the budget. I was looking through the binder that you gave us, and some of the assumptions that y'all are making for the Medicaid supplemental program revenue. It says that it's decreasing by about 18.8 million or 15% due to number one, 7 million reduction, assuming there is no EFMAP federal emergency extension for various Medicaid supplemental program IGTs, and two, the UC reduction of 10 million due to a possible rule change in how the UC is determined. Are we just being very, very conservative here? I mean, or do we know that that stuff is not going to come in?
Okay, this is Michael, and on slide 55, I've talked about on the Medicaid supplemental revenue. Let me address the DISH program, the $6 million DISH program dollar decrease. Now, as of right now, the current legislation that is still written, those Medicaid DISH reductions are still scheduled to occur in November of 2020. Currently, right now, the Senate package does not provide any relief from those Medicaid DISH cuts to be extended. So right now, so without any other further information, we have budgeted that the $6 million DISH program decrease would actually happen. The other part on the $6 million, part of the $6 million reduction is also El Paso Children's. Now, keeping in mind that on the Uniform Hospital Rate Increase Program, the EURA program, although they are getting a $9 million net revenue increase of that, more than likely they will not be able to participate in the DISH program. The $2.5 million decrease in DSRIP, this is mostly related to the overall pool size that the state, as we start entering the last year of the DSRIP program. Historically, this was about $3.1 billion statewide. It decreased about $2.5 billion in 2020, and will be going down to about $2.1 or $2.2 billion in 2021. The top one, the $10 million UC program. Now, this is there has been some discussion already amongst the industry regarding some type of a formula change or payment distribution change primarily that the larger not-for-profits and the for-profits are actually pushing. What we have done in this area is that we have gone the middle of the road from worst case scenario to that happening versus if it does not happen, and we've taken the middle of the road approach with the UC program revenue. So that's the latest information we have regarding those three critical Medicaid supplemental programs.
I could also add what we're seeing also is because of the upcoming election, there are cuts that are being accelerated through CMS. For example, we got news yesterday that on the 340B program, which provides better rates for pharmaceuticals, that is being cut back to some, and that's going to have a negative impact. We have budgeted for that, but they've accelerated trying to get that done. Programs such as MFAR that's detrimental to organizations that intergovernmental transfer such as UMC is being accelerated for approval. The DISH cuts, which we were hoping would be eliminated indefinitely, look like, as best knowledge, it's going to take place sometime this year. So we hope it doesn't happen, and we work with our organizations such as THA, Texas, or Teaching Hospitals of Texas, and America's Essential Hospitals very closely as nationwide we push for these things not to take place. But this budget is based on what is currently known, so I would really hope that some of these things don't happen, but we don't have any indication that would give us relative comfort from a budgeting standpoint to assume that it will happen. Are there any other questions?
To understand, I mean, we're proposing here to stay at the current tax rate, which I mean I think is good, because we're not proposing any tax increase that would be attributable to the hospital district. However, because property values have gone up, people are still going to see an increase, and we're still going to see a bit of an increase in revenue for that. And I was just wondering, in the where, I mean, if it's at all possible, I don't know, that there's somewhere in the what is it, 800 million, 933 million budget that we expense budget that we have. There's not a way to find, that whatever that $1,040,000 that we're gonna be, that we could basically go back down to the effective rate and kind of give folks some relief. I mean, because everything that's gone on this year, it's really hard. I know that we're not increasing the tax rate, but at the same time, people are still going to have to pay a little bit more, even though it's $4 or $5 the whole year. I mean, you add that to what the county's rate's going to be, what the school district's rate's going to be, what the city's rate's going to be. I don't know where people are going to end up on all their budgets, but I think that if it's, I don't know if it's possible to find that $1 million or the $1.1 million that we're going to be, I guess, generating in additional revenue, because we're staying at the current rate as opposed to going to the effective rate or the no new revenue rate, and that way, at least from the county hospital district standpoint, not only will we be not raising their taxes, but helping, because their tax bill won't go up because of the cost of because of the increase in the valuation. I don't know if it's possible, but I'm just I was wondering about some of those assumptions, if they're very conservative, if there's or if those things are actually going to happen or not. I mean, if there's other things that maybe we're being really, really conservative, and I think it's good to be conservative. Don't get me wrong, but just want to put that out there and see if there's there may be any way that we could look at doing that.
We can. One of the things we did talk about that. I know the city has commented that they're going to stay at their current rate. We had asked to stay at the current rate, and that's what we're asking for. The impact is about a little over $3 per household per year, basically the average household rate. The increase in property taxes about $1.1 million. Our increase at uncompensated care is considerably higher. As you can see, we're looking at growing the expansion. It's over like 27% growth in uncompensated care that is not covered by our property tax. So we're going to have a growth to about $109 million deficit. It used to run at about $80 million, and it's climbed since up to about the $109 million gap. Keep in mind too that we've had growth in the community. There's new households out there as well. We recognize that, but we've also expanded services, and we have run, for example, with the COVID-19 testing in our clinics. We've done that with a lot of staff working multiple hours. We've assisted public health when they were short test kits. We assisted the psychiatric hospital when they needed test kits and support from medical staff to help them conduct their testing. And then if you look at medical inflation alone, it is much higher than the incremental growth in property tax. I worry that in the past, for many, many years, we really didn't focus on that. We're always trying to hold the line there. And I really feel that even though it may not seem like a lot, given that we don't know what's gonna happen in fiscal year 21, given that even with the funds we have, if we were looking at what our rating agencies want of a 90 days cash on hand, we would still be 90 million short. If we have a shutdown in elective cases for 3 months, all that CARES Act money would be gone. And so it may not seem like a lot, but for us, it may make the difference between a service continuing or not if some of the worst case scenarios take place. And I really hope they don't, David. There's things we want to do that we're going to delay to the next fiscal year relating to things that are important, I think, not only to the services we provide to the community, but the things we do with our staff. So, you know, we obviously defer to our commissioners and our judge as to what you'd like to do. But we really felt that now was not the time to reduce that amount, but to stay with the current rate that was approved last year.
Yeah, I understand everything you're saying. I understand everything you're saying, Jacob. It just, I mean, we have to be very, very transparent, I think, with the public and letting them know that if we adopt the current rate, they're still going to be paying more taxes because of the fact that their property values are going up. So. That's I think that needs to be made abundantly clear to the public that no, we're not looking at raising the tax rate, but you're still going to be paying more. And a lot of times constituents will call and they'll be confused because they said, oh, we thought you all didn't raise taxes. Well, we didn't raise the rate. However, they're going up because property values are going up, and that's an important piece of being transparent, I think, and I realize that it's not a lot, but if the city is going to stay at the current rate, that means people are going to be paying more taxes to the city as well. We still haven't gotten into county's budget. I know we've talked about holding the line, but we haven't had a conversation about whether staying at the current rate we can do it or whether we could actually go down as well. So, I mean, just wanted to, put that out there.
Thank you.
And, Thank you, Commissioner. Commissioner Leon,
and I agree.
Commissioner Leon, did you have...
I'm sorry?
Commissioner Leon had a comment, I believe.
Yes, Jacob, if you're going to finish a thought, go ahead, please.
Well, I was just going to say that, the rate stays the same, but the revenue goes up. It's true, because if there's additional properties that are being added to the tax rolls, if values have gone up, we know that based on the projections, it would be about an increase of $3 a year. But I also, and I've had this conversation before too, there's more households, a percentage of which are going to need our care, whether it be at our neighborhood clinics, our emergency satellite centers, or our trauma center. And so all that really means to me is you get the same amount of dollars for a population in 2020 to spend on more people in 2021, which means mathematically I'm going to have to provide less dollars per patient coming in. And it just doesn't make sense. When you look at the comparisons we have to the other safety net hospitals, I think we've been a real good example of really minimizing our reliance on tax revenue compared to the other safety net hospitals. I was talking to the CEO from the university in San Antonio, and he said that, one of the things that sometimes he gets challenged on is how can, UMC El Paso do what we do for the amount of tax revenue we get versus some of the other safety net hospitals. And it is because we really work hard. We know, we live in this community. We know our community tax base is not quite the same as it is in the larger cities with a lot of commercial and industrial. We know that. Nonetheless, when we provide surgery or emergency services, salaries to the physicians, the cost of implants and surgical devices run the same as they would in Dallas, San Antonio, or Austin. So it may not seem like a lot, and I understand your position, Commissioner, I really do. We could look at that. Our preference is not knowing what's going to happen in fiscal year 21. That's a concern for me. It may not seem like a lot of money, and I'll defer to, my commissioners and judges to what you want us to do. Clearly, we'll follow along, but we did think about all those factors. And, I think when you look at our numbers, we do very well in managing our tax dollars and how they're spent.
Yeah, I mean, I definitely agree. I mean, it's the amount of money that comes from tax revenue is much less here than it is in other places, and I've been an advocate for many years for making sure that we're paying our employees what the market says they should be paid, for raising the minimum wage and a lot of our workforce benefits and pay. And so I definitely and I appreciate the willingness on UMC's board, on behalf of UMC's board and your team, Jacob, to bring a lot of those things to fruition. And I mean, we've increased taxes over the last number of years at UMC, and it's definitely a change to not even be asking for an increase this year. I just thought that the amount was so minuscule in comparison to the budget as a whole. A $933 million expense budget. I thought that I know it's not a lot, but at least want to make sure that the public is aware of the fact that if we're staying at the current rate, they're still going to be paying more.
That's true. Thank you. I understand. Commissioner Leon, did you have a question?
Yes, a couple of things. Jacob, I wanted to follow up on what the judge had asked you insofar as salaries, and you mentioned the minimum pay is at $11. And I know in a previous conversation you had expounded on this, and I'm very concerned about, you talk about new programs that you're currently getting off the ground, and you know as well as I do that none of that would be possible without those frontline employees that you call frontline. But even more importantly are the lowest paid employees that you have, as we both know and realize that without them, you'd shut down. What is your plan? What is the hospital's plan insofar as getting their salaries up? I know that they're also part of this 1% increase. Can you elaborate on those $11 an hour employees?
I think that right now what we're looking at in the fiscal year 21 budget, there's about $8 million increase due to the 1% merit we're adding to duplicate what we're doing this year, the $11 minimum wage full effect, the 2020 market adjustments, and there are additional market adjustments planned for 21, and the additional staff. The minimum wage at 11 full impact is about almost $4 million alone. What we were looking at doing is, for this fiscal year, is to be conservative and not knowing what cash will be available to us via stimulus funds, what impact we'll have in terms of volumes of the service we owe our community. We were going to look at possibly if we can get through fiscal year 21 well, then in fiscal year 22, look at then at the minimum wage and be going to $11.50 or $12. We know the ultimate goal where it needs to be. We all do. And it'll take years to get there, in doing it without having to, be a major impact to taxes and such, and to recognize the hard work our employees do. I will tell you, Commissioner Leon, I had environmental services people come to me and thank me for the minimum wage. And I will tell you that this is something that you, Commissioner Stout, and others have really advocated for. And I'm appreciative of that because not many places that look to caring for their associates like we have through the county and the hospital district. I think right now just prudence requires that we be conservative for fiscal year 21. I'm hoping that we get an effective vaccine that's distributed to everyone, that by the end of March or June of next year, we'll be in a better position to know what the new normal is going to be. But you're right, Commissioner Leon. The foundation of any organization is going to be its staff.
And as you said, maybe in a few years, but keep in mind that what $12 means today is not going to mean that or the same in 4 or 5, 6 years. So that's very important. And I know you do, take as much interest in the $11 an hour personnel as you do in your management team. And you have a great team all the way through your hospital. So I'm very proud of you. I'm very proud of your team. And I'm extremely proud of those lower wage earners that you've got, because they make that hospital click. And I do have one more question. And going through the charts that you sent us, and you compare the market share in various categories, the only thing I don't see that, and as you know, I'm very interested in urgent care. How are we insofar as the market share in urgent care?
So the satellite EDs are considered emergency rooms. So their numbers roll into our ED visit number. We do have with the satellites, the way they were designed, to be able to have the two, each satellite has a 4-bed fast track. Part of this year's budget includes having those fast tracks run sort of as an urgent care model, which is less expensive, headed by a nurse practitioner that is overseen by a physician, so that if somebody comes to the satellite ED, and it's something minor, rather than charging them an ED rate, we would defer them over to the fast track where a nurse practitioner would provide the care necessary. Additionally, if somebody went to the urgent care component of it and they needed a higher level of care, they just walk a couple of steps over to the satellite ED and get the care they need. We also, in terms, as you know, we have our clinics, and their volumes continue to grow. About 40% of their volume is now done through telehealth. And so part of what we did this year is we invested in our telehealth program, not only here at UMC, but El Paso Health. And so what this does is it allows either via telephone or video, such as an iPad or an iPhone, a physician to actually talk to the person, and it might even save them a trip either to the clinic or the urgent care or satellite ED, because from that interaction, they would be able to write a prescription, call it into the pharmacy of that person's choice, without their having to actually come to a place and wait. And as you know, for those of us that have kids, normally you have somebody that's sick or has pink eye. It's never during a normal day. They wait till it's late at night, and this will help facilitate the care we provide those in our community at a much better rate.
And I agree with you, Jacob, and I'm no expert like you all, but I would think that a big chunk of hospital visits, or I know that in my family, in my circle, are your colds or your cuts or your broken bones that show up in urgent care facilities. So I think if we're not competitive in that area, we're losing a big share. So I just, the point I'm trying to make is that in my opinion, there's a lot of business out there that we may be missing.
Well, and it's going to get better, because not only are we offering that urgent care component, but if you don't even want to leave your home, shortly you'll be able to just, dial in on a link, talk to a physician. Physician can via your cell phone or your iPad assess the patient and actually call in your prescription if you need it at a much lower cost without even having to leave your home.
That's good news all around. And again, congratulations to you and to Dr. Stout for the great job that's going on over at the children's side. I'm very proud of you all doing a great job, and hopefully we can arrive at a budget that we're all very proud of.
Thank you, Commissioner. Are there any other questions?
Thank you, Michael.
If there are no other questions, I guess the next step would be, do you feel we need another joint meeting, or did we answer your questions to your satisfaction? This step is, I think, from Michael's standpoint, depending on which decision we make will affect the schedule of events that need to take place.
Well, Jacob, you've done a great job on the presentation, but also taking the time to give us individually an orientation and sending the material ahead of time. Like I'm very pleased with the relationship and in your presentation. So, commissioners?
Judge, this is Commissioner Stout.
Go ahead, Commissioner Stout.
Jacob and Michael, I brought this up in the meeting that we had the other day, and I wanted to see if I could just get some more information, maybe when it comes to the retirement, the TCDRS, the retirement plan, and at what level at what level that is actually funded. For example, I think Wally, I think you're on at the county, we're at like 85%. I'm curious at what level the
unfunded liability.
Yeah, what
unfunded
level
liability.
that is, and how much, I guess, how much additional is going to be infused into that to keep it at that same level, or kind of looking. I don't know, Betsy or Wally, if you all have an idea. I mean, the type, kind of like the same type of information that we got from TCDRS on our own fund, where it's funded, how much the market went down, and how much we have to put in additionally because market went down over the last 5 years and or up, and just to kind of understand that.
Commissioner, this is Michael. On slide 38 are some of the key components regarding the TCDRS program for the UMC and El Paso Health Associates. On the second bullet, under the funded ratio, currently as of December 31st, 2019, the hospital district's plan was funded at 92% compared to the previous year of 85%. Now, the next bullet talking about the funding percentage is actually going to decrease, and this is the information we've gotten from TCDRS that our funding percentage, which was 7.84% in 2020, will be decreasing to 7.57 in 2021. So those are the key components in terms of the funded status of the plan assets to the plan obligation, and then also at what percentage of covered payroll we are going to fund in 2021.
Okay, so that means that the funding percentage is decreasing. You're not having to put more money from, like, you're not having to infuse more into that fund to keep it at the same level, right?
Right. Well, in terms of at least the communication we got from TCDRS. Now that's the minimum required contribution rate for us as that has been determined actuarially given our plan performance.
And Commissioner Stout, TCDRS does an actuarial study, and in that rate there is a built-in factor to increase the funded ratio over a 20-year period of time, or a several-year period of time. So that rate is geared towards holding the current funded ratio or increasing it based on future return projections.
Now, this is Michael again. I will go back to validate, but I believe this is the first year that we've actually had a funding percentage decrease, given the fact of the market crash back in 2008, 2009. Each individual year since 2008 or 2009, we've had a percentage increase. But I will go back and do a 10-year analysis on that.
And we'll be glad to provide it to you, Commissioner Stout, so you have it handy.
Yeah, I mean, I'm just asking because so the 92%, I mean, the county, I think we're at 85, and we're trying to increase, and so we've infused some money into that. But 92% is, I think, a really good position to be in, because that basically means that, like, if you if all of your folks retired at once, then you'd be able to pay 92% of it, right? That's kind of what that means.
Yes, that is exactly what that means. And in fact, it's probably maybe been about a year and a half ago that we actually had TCDR's representatives do a presentation to the El Paso County Hospital District Board. And back then, with a funded ratio of 85%, in their opinion, they thought that was a good funded ratio to be in, and we were in the upper echelon in terms of funded status for pension plans, and that was 2 years ago.
Judge, Commissioners, Wally Hargrove from the Office of Budget Fiscal Policy. Michael's correct. The plan as a whole for all participants is about a little over 86% across the state. So the hospital district is sitting in that upper echelon of funding. Comparatively speaking, we were at 85% last year and are at 85.6% this year. And we did experience a small funding increase, which will cost us a little bit more this fiscal year.
Right. Okay. I just wanted a little bit of clarification on that. Thanks. I appreciate it.
Sure thing. So getting back to the proposed schedule, I guess the question would be if you, Judge and Commissioners, feel we need a second joint session, or if this was sufficient, because that'll affect the timetable we go forward with, as shown on the screen by Michael.
Judge, I'm satisfied with what's already been presented.
Me too, I agree. Commissioner Stout?
Yeah, I'm fine. You know, I've had a presentation from Michael and Jacob on my own in this presentation, so I think I have all the information that I need.
Thank you. Commissioner Perez? Commissioner Robinson?
Thanks, Judge.
Yes, sir.
Thanks, Judge.
I'm satisfied with the presentation. I'm okay with the presentation.
Okay, thank you, Commissioner.
Yes,
So,
sir,
yeah.
Commissioner Perez is on.
Jacob, go ahead.
Yeah, I was just going to say, I mean, we've typically or historically have done two presentations if solely just for the public's benefit, but whatever the court decides to go with, I'm fine with that.
Thank you, Commissioner. Jacob, it looks like we're okay with this presentation.
Thank you, Judge. So then we'll go ahead and work on proceeding with the schedule as Michael has on the screen here. And always know there's questions that come up later. Feel free to call us. We'll be glad to get you those answers as quickly as we can.
This is Michael.
And to the public, if there's any questions that they could, I'm sorry, I was saying that to the public as well, if there's any questions or anything that they could go through the commissioners and the different precincts and myself, and then we would relay and try to get those answers, directly from your people, Jacob and Cindy and Frank.
Gladly.
So with that said, with the decision that a second budget work session is not needed, so I guess going forward, I and Omar will work with Betsy and Wally regarding the calendar going forward regarding the dates for the well, let's talk about them right now, because I currently have right now on Monday, this coming Monday, August 10th, would be the date that the Commissioner Court proposes a tax rate. Is that date still being held for August 10th, or has that been, I know there have been discussions to maybe slide that 1 week to August 17th?
Betsy, you want to field that one?
So we actually have our budget hearings will be starting during next week. Normally the court would propose a tax rate, but it's not necessarily the tax rate you would adopt. We actually have that on the agenda. Wally, that's on for tomorrow, correct?
For tomorrow? No, not for a tomorrow agenda, no, ma'am.
Okay, for next Monday, we have it on for the.
Yeah, we had it either on for next Monday the 10th or after we concluded our hearings for Monday the 17th. We could propose.
Betsy, can we have Michael coordinate with you and Wally on finalizing the schedule, and that way we can let our board know and you can let our commissioners know as well?
Yes.
Certainly.
Okay, perfect.
Thank you.
Thank you all very much.
Okay,
really
yes.
appreciate it.
Thank you, Caesar.
Okay. Homer, do we need a motion?
Yeah, for budget and the tax rate. So we need a motion for the proposal of the tax rate by the Board of Managers, and then the motion to propose the budget for consideration by the Commissioners Court.
And would those have to be separately, or can we do them?
Let's do them individually. So the first motion would be for the consideration of the tax rate to the Commissioners Court.
Do we have a motion?
So moved as presented.
And do we have a second?
Second.
I see the arm.
Okay, yes. We have a first and we have a second. Mr. Gallardo?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Ms. Olguin? Yes. Mr. Volk?
Yes.
Thank you. Consideration of the proposed 2020 tax rate as presented is approved.
And then do we have a motion for
the proposed budget for Commissioners Court consideration?
So moved as presented.
the second?
Okay.
Ms. Levine?
We have a first and a second. Mr. Gallardo?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Ms. Olguin? Yes. Mr. Volk?
Yes.
Thank you. We may, the fiscal year 2021 budget is approved to move forward for consideration by the commissioners. If there's no other additional questions or concerns, may we have a motion to adjourn on our side?
So moved.
Second? Second. Okay. The joint budget session with the Board of Managers and El Paso County Commissioners is officially adjourned. The time is 3:06 p.m.
Judge, Commissioners, thank you very much for your time.
Thank you. Thank you.
Thank you all for your time. Thank you. Great work. Great job. Thank you.
Thank you all.
Thank you, everybody.
Caesar?
Thank you.
Have a good afternoon.
Good job, everybody.
Okay, for Commissioners Court, we have additional items. So if you would stay on the line, please.
For item number 5, which was to take appropriate action on the hospital district's capital and operating budgets, Ms. Sanchez, will we need to take no action on this?
Hi, Caesar?
Yes.
Can you hear me?
Yes.
I'm sorry, my screen's blurry. There we go. For item number 6, which was the accept, that would be a no action.
Item number 5.
Wait, I'm sorry, excuse me. Item number 5, yeah, that is, they've already taken their action on our side. On our side, that would be no action.
Okay, thank you. This brings us to item number 6. Accept the 2020 no new revenue and voter approval tax rate calculations for the El Paso County Hospital District. No new revenue rate 0.265305 per $100 of value. Voter approval rate 0.281185 per $100 of value.
Move to accept.
Good afternoon, County Judge Samaniego and Commissioners. This is Ruben Gonzalez, County Tax Assessor Collector, joined by Angela Brinkley, my county manager, here to present and submit our rates to the court. Did you all hear me?
Thank you, Ruben.
Yes, sir.
We sure can, Ruben. Thank you.
Yes.
Okay. What we want to do here is I want to set a little preview and share with you these new changes in the truth in taxation for this coming year. Were part of the last legislative session that passed Senate Bill 2. And pretty much this bill changes a lot of the notices and categories and calculations that apply to us, and pretty much basically reforms the property tax appraisal and tax setting processes for all the county and cities and school districts taxing entities. So I just want to give you a little overview of this process. The two purposes of the truth in taxation laws is pretty much to make the taxpayers aware of tax rate proposals that are submitted every year, and to allow the taxpayers to roll back or limit tax increases. And this year, it's going to change the limit from 8% to 3.5%, which is very significant. Pretty much with this in mind, there's four principles in the taxation program where property owners will now have a right to know about the increases in their appraised value and to be notified of the estimated taxes that could result from the new value. Another point is every taxing entity, taxing unit, other than the water district, now has to calculate what we call its no new revenue rate, which is the effective rate from previous years, and a voter approved tax rate, which is a rollback rate from past years, before adopting the current rate. So all this is new terminology, which we have to kind of understand and follow through, but it's for the benefit of the taxpayer so they can understand it much better. A taxing unit must publish a notice about either a public hearing or meeting to adopt a tax rate. And if the taxing unit adopts a tax rate that exceeds the voter approved rate, voters may limit the rate. Next slide, please. Some other highlights of Senate Bill 2, which I've listed only 3 of them, which are pretty significant. This basically creates a searchable tax statewide database to give taxpayers information regarding their tax rates. Another point is it requires tax collectors around the state to have a website to post each tax entity's information, tax rates, and we have to have all these forms available by August 1st or as soon as practical. The rates for the most recent 5 years started in 2020. Contact information for each taxing unit, improved tax notices, and pretty much plain language rate comparisons for property owners. All of this is so that they can be more informed. And also it created a property tax advisory board in the Office of the State Comptroller to improve the effectiveness and efficiencies in the property tax system, specifically between the property owners and the appraisal review boards. I plan to add more information at our website that adds more significant suggestions and information of value to our taxpayers. We're preparing it now, so we'll be placing it on our website here pretty soon. But this is just general information I wanted to share with you that I would hope the taxpayers of our community will take a look at and be more informed. And of course, the intent is to provide more transparency for them to understand how our property taxes, the tax rates are set up, so they can be more informed as to why their taxes go up or how they're established by each taxing entities. So with that in mind, I want to yield my time to Angela Brinkley, my tax accountant, so she can give you and provide you the numbers for your consideration. Okay? Thank you.
Thank you. Good afternoon, Judge and Commissioners. This is Angela Brinkley representing the Tax Assessor's Office. And I'm here to read our rates into the record. This is our regular annual submission of the rates as required under Truth in Taxation. So for the El Paso County Hospital District, the 2020 tax rates calculated for the no new revenue tax rate is 0.265305 per $100 of property value, and the 2020 voter approval tax rate is 0.281185 per $100 of property tax value. We submit these for your approval, acceptance and approval. We hope that you will. Thank you.
Okay, sorry, I think before I was a little precipitous in making the motion, but I remake the motion after this presentation. Thank you, Mr. Gonzalez and staff.
Okay. Well, we need to go through the motions here too. Thank you so much. Okay. Next slide, please. Next agenda item.
Well, go ahead and so we're still on item number 6, and so there was a motion on the floor by Commissioner Stout to accept. Is there a second? And then go ahead and take the roll call vote, please, Mr. Nava.
Judge, I've got a question.
Commissioner Leon, please, before we move forward.
For clarification and for the public's clarification, Wally, can you explain to us and to whoever's listening what this actually means? Are we staying at last year's rate, but there will be an increase because of higher property values?
So gladly, Commissioner. So today, your action is only accepting the calculated rates. So for the public's purpose, you are not setting a tax rate as of yet. The Senate Bill 2 new requirement requires that the tax assessor presents you with those calculated rates by no later than August 7th. So you're just accepting the calculated rates. You're taking no action to set a rate today. On August 10th or 17th, whichever date, you will be proposing the tax rate that is the maximum that you'll consider and take into a public hearing 7 days later. At that public hearing, you'll take feedback from both proponents and opponents of the tax rate, and you will close the public hearing. After that public hearing, what's different from prior years, you're now permitted to have an item on the agenda that would allow you to take action to adopt that tax rate immediately after the public hearing. However, if you don't adopt it that evening, within 7 days after that public hearing, you will have an item on the agenda to adopt the tax rate. You may adopt a tax rate equal to the rate you propose or any amount lower than the amount you propose. So when you propose that tax rate, that is the ceiling. So today's action is merely an acceptance of a calculated rate.
Okay, thank you. And that's a range, is that correct, Wally?
So that what's being presented to you is both the minimum rate, which is the no new taxes rate, and the maximum the court could consider proposing, that is the voter approval rate.
And just to clarify, Wally, today, this is just the calculations based on the information that we've received from the Central Appraisal District, correct, Wally?
Yes, ma'am.
And so this is nothing to do with setting where in that range you'll be. It's just knowing what those calculations are.
Correct. That will be on your agenda either this upcoming Monday or the Monday after.
Thank you both. Great clarification. Thank you, Commissioner.
Yes.
We have a second.
Seconded by the judge. Commissioner Pettis?
Just for the county or just the hospital?
Go ahead, Commissioner Pettis. You're unmuted.
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samaniego.
Aye.
Motion carries. Item number 7. Accept the 2020 no new revenue and voter approval tax rate calculations for El Paso County. No new revenue rate of 0.483827 per $100. Voter approval rate of 0.489493 per $100.
Thank you, Angela Brinkley again for the tax district collector. We are submitting these rates for your acceptance as required, and those rates are again the 2020 no new revenue tax rate for El Paso County of 0.483827 for $100 evaluation, and the 2020 El Paso County voter approval tax rate of 0.489493 for $100 of evaluation. We ask that you accept these rates as calculated.
So moved.
I've got a question real quick.
Go ahead, Commissioner
Is
Stout.
this, yeah, the voter approval, the voter approve rate here, this is the 3.5% cap rate that was applied to counties. It's not the 8% rollback rate, it's the 3.5, correct?
That is correct, yes.
Okay, so because we're in a state of emergency, I understood that this year and probably maybe even next year, the county would be able to go up to the 8%. So we don't need to make that our high range for public purposes.
You are, as a governing body, you are able to direct us to use that as the limit. However, I believe we have a letter indicating that exemption is specific to physical property damage and not to damage due to a pandemic. So that would be at your discretion.
Okay. I don't know if we can get some, I mean, not, I just think that I didn't realize it was just physical property damage. I thought that there was that the 3.5 rate was not applicable this year because of what's going on with the pandemic. Is that, do we have a legal opinion on that?
Angela, and who did that letter come from?
I'm looking for it right now. It was provided to me by Mr. Utterbeck from the auditor's office, and I believe it was a letter ruling from the state that asked for an opinion as to whether that would be up for consideration. And let me see if I have, I'm not at my desk, I apologize. See if I have it in my file here.
This is Edward Dion, County Auditor. That was an Attorney General opinion that came through. We're looking for the number right now.
Yes, thank you, Ed. I just don't have it. I don't have it in front of me right now. I apologize.
I know that Wally has asked, I think, for an attorney or for a county attorney opinion on this, but it was recently. So I don't know if they have issued one on it. Correct, Wally?
Yes, ma'am, you are correct. And I believe Ms. Christina Sanchez will weigh in behind me.
Hi, Commissioners, County Judge Commissioners, Christina Sanchez, Assistant County Attorney. There was a request for an opinion that was issued by Wally to look at that because there was discussion as to whether or not that that language as to whether a county had declared a state of disaster, as to whether that then goes to the voter approval at the 8%. And it's our legal opinion that because the governor had declared that state of a disaster for all those Texas counties back on March 13th, and also the county judge has declared similarly, as well as the mayor has issued it, that the approval weight that would be applicable would be at that 8%. I know that other jurisdictions have also looked at that as well. It is their opinion that would follow the same that's the same guidance that we have received. We've also attended a couple of seminars that have been put on that was also the information that was provided, that it would be applicable to a pandemic situation. Now, I know that there has been discussion both in the paper, comments that have been made by the AG with regards to that the declaration of disaster does not apply to a pandemic situation, but there is no specific carve out for that in the legislation that was passed by SB 2. That may change whether or not there's further litigation or any other further guidance that's been offered by the AG, but at this point there has not been anything solidified or concrete to say that a county could not declare it at the 8%. And that we find ourselves in a emergency situation because of that disaster declaration that was issued.
Yeah, I mean, I just don't want to make, I'm not saying we're making a declaration that we're even trying to get up to the 8%, but I think it's important for the public as we're, posting these rates and making them public, that they understand that it's our interpretation that's a possibility, that's within our authority to do so.
Thank you, Commissioner.
Judge, if you have, or Judge or the commissioners, if you have any further questions regarding that or what that may mean, we haven't, right now we're discussing at this point just the acceptance of what has been provided by the CAD. Nothing concrete has been set, but if you would like further direction on that, we can go into executive session to receive that legal advice under 071. Right now, I believe that the posting would allow for that. Or if you wish, we can post that for another meeting, perhaps on Monday, to go into more detail and discussion on what that would mean. Again, there's no affirmative action at this point in terms of what the county is going to be deciding, but we certainly can provide that as a legal advice manner to the court.
It just would be too late to accept those rates because the deadline to accept these rates is August 7th.
So we could go in right now if you want to, Commissioner, if you have any further questions at this point.
I mean, I don't think I have any further legal questions. I mean, I just wanted to make sure that we're doing the right, we're approving or accepting the correct ceiling.
We're basing it on the AG's opinion. It doesn't prevent the court in the future, Christina, correct me if I'm wrong, it doesn't prevent you in the future from challenging that opinion. But at this time, we're proposing them and asking that the court accept them in accordance with that opinion, not necessarily meaning that we're in agreement with it.
Right, and you haven't done anything that would trigger those dates anyway. That would again trigger those hearing dates and trigger further approval of those dates. At this point, it's just again the acceptance of what the CAD has provided at this point.
Christina, Judge Commissioners Wally Hargrove from the Office of Budget and Fiscal Policy. So the direction that the tax assessor will take from the acceptance of today's rates is that tax assessors now required, oh, I'm sorry, they're no longer required to do that publication in the Times. Are you required to publish this, Angela?
Mr. Gonzalez's webcam is muted. If you can unmute yourself, please.
There we go. Hello, no, we're no longer required to publish in the paper. We are required to post notice on our website, on the homepage of our website, as are all taxing entities now. And that was going to be subject of my next slide, the next agenda item. So no, at this point, we don't have to publish anything other than the notice by Friday.
Right, so that they have to publish on their website by Friday. So if
Correct.
we accept today's rates, they would be publishing today's, I believe, accepted rates.
They would be published as accepted today on the website. Am I coming through?
Thank you.
Yes.
I'm sorry. Oh, okay.
Okay. Caesar, you want to go ahead?
We have a motion from the judge and a second from Commissioner Leon to accept. Commissioner Perez.
Aye.
Commissioner Leon.
Aye.
Commissioner Stout.
Aye.
Commissioner Robinson.
Aye.
Judge Samaniego.
Aye.
Motion carries. Item number 8, approve and authorize the publication of any and all related tax notices in the El Paso Times, El Diario, and the West Texas Courier for the El Paso County Hospital District and the El Paso County Emergency Services District Number 1 on or about the week of August 2nd, 2020. Funding is available in General Fund Tax Office Advertising.
Good afternoon, Commissioners. Angela Brinkley again from the Office of the Tax Assessor Collector. I'm providing this slide because this is what it would cost in order to publish the rate notices of the calculated rate notices under the last year's requirements that these notices be published in the paper. Under SB 2, now as mentioned earlier, these notices are no longer required to be published in the paper, but must be published only on the entity's homepage of their website. So we are presenting these in the event that UMC and ESD1 would like to. They are not precluded from publishing in the paper. However, there is not required, but this is part of our budget, and we do routinely present these so that you understand the cost of this and ask for your approval to publish, if so decided. So we are presenting these rates and ask for you to accept these rates as published, but under these new requirements, it will really be up to the entities to decide if they need to publish in the paper and incur that cost. Any questions?
Move to approve.
Second.
Judge, Commissioners, so are you approving, are you recommending we publish these even though it's no longer statutorily required? I think, Angela, are you asking whether or not we want these published or just online?
You know, at this point, just online, just that we allowed. I'm not really asking for to expend these monies. I've already been informed by ESD1 that they have no interest in publishing these rates, in publishing the worksheet. We will simply be posting it on their website. I suspect UMC will decide to do the same. I just didn't want this to disappear from the presentation and it's all of a sudden without explanation. But if they do decide to publish this, so I'm just wanting to present these rates, let you understand what those costs would be.
Yeah, hi. Hello?
Sorry.
Okay, so I guess I just want to be clear because I'm confused on the agenda item because this is authorizing the publication of these rates, but that's no longer required to be done.
Let me ask you
true.
this,
So
Angela.
Yes.
Angela, what is the cost of that publication? Yeah, I believe in, I guess in this case, transparency. I mean, so people, even though we're not required to do this, but we go ahead and do that. What is the cost to publish these amounts?
Yes, there is stated the cost for UMC to publish in the Times would be the $1,943.75, and they routinely also publish in the El Diario. And it would cost $700 this year to publish that notice, with a total cost to UMC of $2,643.75. ESD1 publishes in the West Texas Courier. That is their paper of widest distribution in that area. And that cost would be for that one-day notice would be $770 even.
But the
that money
only
is available in
mandatory
the budget.
direction that we have, it has to be on our website. That's it.
Yes, absolutely on the website. Must be on the website. This is just a notice. The notice has changed somewhat. We are still actually working on finalizing these notices because of all the changes. You know, the devil's in the implementation. And we've basically had a week to try to work with our software provider and the comptroller's office, getting these notices accurate and complete as required under SB2. So we are actually finalizing those right now, and we'll be distributing those to the entities for whom we assist with rate calculations, so that they may post this on their websites.
Okay, thank you.
You're welcome.
And just, again, I want to make sure I understand too, this also is not proposing advertising the county's rate. It's just the rate for UMC and ESD1.
That is correct. We haven't had to publish the county's rate for at least the last 2 years at this point. Simply put on the website.
No, thank you.
Commissioner Pettis?
Aye.
Commissioner Leon?
Now, just for clarity, we're just voting on those two entities to be able to publicize the tax rate. Is that correct?
That is correct. Yes, sir.
Aye.
Commissioner Stout?
Aye.
Commissioner Robinson?
Aye.
Judge Samaniego?
Aye.
Motion carries.
Thank you very much.
Thank you.
You have a great afternoon.
Item number 9, accept the certification of additional sales and use tax to pay debt services.
Good afternoon, Judge, Commissioners, Edward Dion, County Auditor. This information was provided to the tax assessor collector. This is part of the numbers that are required to do the tax calculation. Counties in Texas that levy sales tax are required to calculate the excess to be used as a reduction of debt for future years. So in the last calculation that we did for the current 2020 fiscal year, we had to calculate the prior 4 quarters of sales tax. That number was $48,922,033.97. And that is compared to the fiscal year 2019 sales tax collected for the year and netted by the economic development distributions that were made. That totaled $51,238,570.51. Therefore, the difference that was used to reduce the amount of funds required to pay for next year's debt service is $2,316,536.54. This was provided to the tax assessor, and this information was used in calculating the rates that you approved previously. This is a requirement that changed with Senate Bill 2, and we're providing it as required. Any questions?
Move to approve.
Second?
Commissioner Pettis?
Aye.
Commissioner Leon?
Aye.
Commissioner Stout?
Aye.
Commissioner Robinson?
Aye.
Judge Samaniego?
Aye.
Motion carries.
Thank you very much.
Thank you, Dion.
Item number 10. Pursuant to the Texas Local Government Code, Section 115.021, audit and settle all accounts against the county shown on the attached listing and direct the payment of those accounts.
Yes, Judge, Commissioners, this is your normal paid claim since we didn't have a Monday meeting. You've all been provided with all the documentation. Does anybody have any questions in this regard?
Thank you, Ed. Move to approve.
Second?
Commissioner Perez,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samanil.
Aye.
Motion carries.
Thank you. Stay safe.
Thank you, Ed.
Thank you, you too.
And that completes all the items on our agenda today, Judge.
Okay, meeting adjourned. Thank you, all of you, and see you tomorrow. Have a great Tuesday. Thank you.
Good night.
Good night, everyone. Stay safe.
This concludes
Thank you all
today's
very much.
meeting at 3:38 p.m.